Radio Democracy, for news, views, and entertainment. Radio Democracy, Radio Democracy, Radio Democracy, for news, views, and entertainment. The true voice of the people. Radio D, to you there's no equal.
Second to none. Radio D, you're still number one.
You are the voice of the voiceless. You are the choice of the voiceless.
Real. Sure.
Stay tuned to 98.1 FM. It's exactly 12 o'clock. We will now join Studio 2 and bring you the program, The Midday Show. Stay tuned.
Stay tuned to Society for Radio Democracy. 98.1. Simply the best.
Good day and welcome to the program Midday Show, where they come to you live from the Society for Radio Democracy 98.1 FM. And you same way so they get me live on the internet on www.radiodemocracy.sl. Mina Adeyemi Jackson, where they bring this edition of the program Midday Show come to you. News, information, reports, music, and other things inside the program. So continue for day with me for the next 1 hour. And today inside the program, we topic of discussion, we go look inside the status of the diabetes sickness alone and waiting government and other people need for do for CCA that tap the spread of the diabetes sickness the country. And therefore joined at the studio by the founder Friends of Diabetes Sierra Leone, when a organization we don't raise awareness about the diabetes sick. We are going to talk to the founder Salome Hills. We going to talk about what the organization don't they do for CCA. They work with the authorities like the Ministry of Health for raise awareness about the diabetes sick and serve waiting people for do for CCA they not get the sick. You can be part of the program by way you can send message to the number 077-981-981 or go now we get the Democracy Facebook page and also we YouTube page. Also you can follow the program live. Drop a question or comment on the issue we will discuss inside the program today. The program na Midday Show. The program na Midday Show and they come to you live from the Society for Radio Democracy 98.1 FM. Inside the program, we start for look at issues at the program. One specialist physician na Connaught Teaching Hospital, Dr. Mohammed Smith say, one study we then do show say type 2 of the diabetes sick don't responsible for the plenty die and can affect mostly people who don't reach the age of 40 and above. They talk this inside the second annual diabetes conference with Friends of Diabetes Salon Hall for raise awareness about the diabetes sick and self do free tests to people for nobody status. I'll be part of this engagement and put these reports together. According to the International Diabetes Federation, now over 5 million people aged 20 to 79 believe say they live with the diabetes sick now the world. With this number will go up to 8 million by 2050 if country them now the world not do something for fight the diabetes sick. The report also shows say but 252 million people when are adults not aware say they get the sick and plenty of them people them here they live in a low and middle income country them. And Salon, now one part them country them here, but concern whether they come out now that better awareness of the diabetes sick not they. We make Friends of Diabetes Salon when our body we make up of different organization and health professional them. We come together for raise awareness and provide support for people who get the diabetes sick. And one way where they don't do this now through the annual Diabetes National Conference where they keep all where they talk. The founder for Friends of Diabetes Salon, Salome Hills, explain more about this conference.
Today we're here to raise awareness of diabetes, especially type 1 and the complications that comes comes with it, because type 1 accounts for about just 10%, but now we have a lot of children dying from type 1 diabetes and no one knows about it. Well, the fingertip test we're doing today will not determine whether somebody is diabetic or not. But if we see that you have high glucose levels, we'll advise you, and then we'll come to you or you come to us. We'll do your screening for over maybe 3 weeks period, and then we'll advise you on what to eat and what not to eat. And if it still persists to be high, we'll do referrals to the PHUs or to specialist doctors.
Madam Salome Hills also talk about what the organization don't they do for CC. They reduce the spread of the diabetes sick na Salone.
We did lots of radio talks, and we went to communities to tell them that we're doing a free screening today, that people should come. We're screening free for diabetes and hypertension, because those are the two NCDs that are referred to as silent killers. People can live with type 2 diabetes for about 10 years without knowing they have it, and sometimes they will have, they go into comas, they have slow healing wounds, they have amputations before they know they have diabetes. So what we're doing is raise awareness and teach people how to manage it, and also be aware that it is on the rise and that you need to take care of yourself. Know your figures and take care of yourself.
But waiting at diabetes, Dr. Mohammed Smith, a specialist physician at the Connaught Hospital, he explained.
So diabetes, we say that a chronic metabolic disorder, okay? So now something where a chronic medical condition where the body not able to regulate the sugar. So we further say the body, normally when you eat, we require energy from the food we eat. But the body gets an organ we refer to as the pancreas. And this pancreas is responsible for release one chemical called insulin. And this insulin then they help the body for them be able to use the food we take. So in a situation wherein this particular insulin, either it is the pancreas, whether the organ where they produce and not they produce at all, or the insulin where they produce not able to work fine, then it will lead to diabetes.
Dr. Smith also talked about the different type of diabetes sick and how they can affect people.
So what are the types of diabetes? We get 3 major types of diabetes. We get what we call type 1 diabetes. What is this type 1 diabetes? Type 1 diabetes, now diabetes most times when they call in beginning, they begin to experience the symptoms as early as possible. Type 1 diabetes. In not too common, most of the time around 10% of people. The one way popular type 2 diabetes, most times they occur as a result of either this body able to produce the insulin, but the insulin not able to work better. They produce the insulin, but the insulin not work. Okay, so I just take an analogy from that. But most of the time, they occur in people that don't carry age now, or 40 and above.
During this conference, Friends of Diabetes Salone will provide free tests for people who attend this conference. We make a later ask some of them what do they think about the diabetes sick.
Much of the things that they understand today, and I like it a lot. And I also feel excited because I learned something that so looks strange to me, and I promise to make it an responsibility to my own side, to admonish to my own friends at school, to let them understand they need to do like all our friends.
My name is Mariam Ayelowo. Together Muslim woman. I learn lots of things. I learn what is diabetes. Diabetes teaches us lots of things. How to prevent your body. How you should manage some of the food when you.
Then people here end up for tell thank you to Friends of Diabetes Salone and their partner them for where they organize this conference and promise say they will implement all the things them where they don't learn for the Society for Radio Democracy. Adeyemi Jackson, the report. The program La Midday Show and they come to you live from the Society for Radio Democracy 98.1 FM. As I mentioned earlier, today inside the program we go look at the status of the diabetes sickness Salone. And for can't talk more on that, I get the founder for Friends of Diabetes Salone, where in Salome Hills, where go can talk about the what the organization don't they do for CC. They raise more awareness about the diabetes sickness Salone and say waiting government and other people for do for CC they tap the spread of the diabetes sickness in the country. Good afternoon and welcome to the program Midday Show. When you talk of, before we can look at the diabetes sick itself, when you talk of Friends of Diabetes Salon, what do you bring about this organization?
Okay. Wetin bring about the awareness raising of Friends of Diabetes Sierra Leone and the Salone community now from a personal perspective. Something happened in my family where I lost a dear one to the complications of diabetes. And because of that, after some years of pondering over waiting, I go give back to Salone, and I decided say I go can start for raise diabetes awareness because I lost somebody will be very dear to me, and waiting me make that happen and because we be ignorant of the sickness itself or the condition we then call diabetes. So because of that, I say that lack of knowledge will make we lose that we love one. Let we start for raise awareness now the communities and let people then know say this sickness day and waiting at the complications, waiting they do to people them. And if you already don't get her, how you go manage her. And if you not get her yet, we go still teach you how you go try your best not forget them. So now so this thing here so start. Now so the Friends of Diabetes start with me picking in England and good friends that we come around me. We start this whole thing in 2011. We start for celebrate World Diabetes Day 2013. For the first time in the history of Sierra Leone, we celebrate World Diabetes Day, and then we get with Ministry of Health and Sanitation and the Directorate of Non-Communicable Diseases. We all begin come together for DUAM as part of the global network for diabetes awareness raising every November 14 every year. Since that time, we done the DUAM.
Okay. So since 2011, we una set up this organization for the raise awareness about the diabetes sick. How it don't select for now?
Well, we don't screen lots of people. We don't go to lots of communities around Freetown, even the provinces. We don't go Bo. We get a diabetes screening center, Nakabala. We don't go Bond. We don't go Sierra Rutai. Every side we get affiliation. If I go there on holidays, I go make sure say I screen people them, advise people them, cancel people them. If I get medication, I give people the medication for diabetes. Because diabetes is also just a Sierra Leone problem, like a worldwide problem, a global problem where little is being done for make we combat this diabetes. And one of the killer diseases, and we call them non-communicable diseases because you know they get and just by touching me like we go get Ebola or COVID. This again for be the bloodline or you where they live. We will say your lifestyle will make you get her or you don't inherit her, which is hereditary. Now that they make you get them. So not so just a Salone problem, a whole wide world problem, a global disturbance where everybody they suffer from, but mainly other than they suffer more now people that waiting at the low and income countries.
Okay, we can look at the impact of this sick on the lives of people. But for the ordinary people or for the layman out there where they listen and watch you live, when you talk of the diabetes sick, what's in a diabetes?
Diabetes now where you get abnormal sugar levels now your blood. When we say abnormal sugar levels, we all get everything where they happen that we body gets levels. So when you eat food, the food go inside your belly, it digests. The proteins then go inside and they go for growth. The fats and oils go inside and they go. The carbohydrates, they turn to simple sugars. It go give you energy. So for somebody who get diabetes or where they don't say get diabetes, in your own glucose where you don't get from the food, from starchy food, from carbohydrate foods, insulin na some hormone wey dey that we body when they open the cell doors them for let this glucose go inside and give you energy. But for people that will get diabetes, they not they produce too much insulin or they not they produce insulin at all. And if that they happen, the glucose wey dey in the blood go just they go all over your body, they cause damage for your nerves them. And now they go inside supposed for go because insulin or they when are the key for open your cell doors them for let the glucose go give you energy. If you take people that will they do sports, you dey see them they drink glucose and they mix the white powder glucose and drink and forget the energy. So now so that glucose, the way we eat starchy foods, they go happen. But again, when the starchy foods too much now your body, then you don't produce enough insulin for go work with this glucose. That's why they left now your bloodstream. So anybody will get that, where they say you get abnormal glucose levels that your blood, way not today supposed for day. So now that's the simple way we are going to explain within diabetes. Abnormal sugar levels or abnormal glucose levels now your blood.
Now we look at the different types of the diabetes sick. What are the different types of the diabetes sick, and which one are the most common one now salon?
We get loads of diabetes classes, or we get different types of diabetes. We get type 1, we get type 2, we get gestational diabetes, we get now type 3C, and then we get type 5. But apart from that, then we get some other types of diabetes we're not really common na salon, or even the whole world will not get too much of the monogenic one. Them one people then gets the condition, and then they not get for do with glucose levels at all. But type 1 we call an adolescent diabetes. In the day pan picking, if you were then born until day first day, picking and go diagnose and say get type 1 diabetes. Type 2 now the one where we they get where we don't pass 40. But for now, we they even catch people that way they from 25 to 30 to 35. Another kind day back where they old you, we can say now late onset of type 1. Then we get the type 3C, when last year, April, the big organization for diabetes don't give that name day again. It say type 3C don't day and type 5 don't day. For the type 3C, now people then way get like pancreatic cancer, where the cancer don't unblock them pancreas. These are the organ where they produce insulin in your body. Then the other one again are for picking them where don't suffer some massive infection, where that infection don't affect the pancreas again. The pancreas don't produce enough insulin. Now the type then, but the most common types where we talk about now the type 1 for picking them, type 2 for adults, and then the gestational diabetes where they unblock belly woman them. And that's type the gestational diabetes. Sometimes in the now the woman in lifestyle again where it pregnant, in food, in lifestyle. So where it born the picking, the diabetes can go away until it get pregnant again, then the diabetes come back. Then you go deep on that so they say maybe you don't done for born before it is 40. Then you don't get at risk for get the type 2 from that gestational diabetes. That again can be say in mama being get gestational diabetes where you get in belly, or it just catch up from in mama, maybe in mama where you reach adult age, you don't get type 2 diabetes. So type 1, type 2, and the gestational diabetes now we they deal with more, but the type 1 self, it don't they plenty, and we don't get challenges na mama salonia so for this type 1 where people they don't know about at all.
Okay, we can look at the challenges again. When you talk of signs and symptoms of this diabetes sick, for the type 1 and type 2, where you say now the most common one them na salonia, what are some of the symptoms, the signs and symptoms, and how somebody go before no say they don't get either the type 1 or the type 2?
Okay, the symptoms for type 1 and type 2 very common. They're similar. The only thing is how effective it happen or how quickly it happen, I know the difference. But for somebody who get type 1 diabetes picking and big person who get type 2, the symptoms are really not classic symptoms. You they drink water too much, then are too much thirst. Then you they go toilet too much. As you they drink, you they feel for go toilet too much. You always tire. You they get blood vision. You they see like cloud then you sight where you they look something. You get cloud round them. Then people that can get frequent infections. Always you get infection. You they go to your doctor. Doctor I get infection. I they scratch. I need antibiotics. You go to your doctor for that. Some people then they make them overeat again. You always hungry. You know, your body they scratch because of too much sugar in your body. So now the classic symptoms and that for both type 1 and type 2, but like I say, how it dey affect the type 1 pikin, you dey look for 4 things. Really, we call them the 4 T's. The one are the thirst, then the toilet, now the second T, then they go thin. That will say the pikin bin get body, you see it reduce, it lost weight, it become thinner. So now the other one, and then the pikin are always tired. So now the 4 T's down the way they look up for pikin wey get type 1. And then they come on quickly, not to like say type 2. Because somebody go live with type 2 diabetes for 10 years and not know say he get them. For 10 years, big person go live with diabetes. The symptoms they go there. Some people not they show symptoms at all. So, but for type 1, quick, you go see say this pikin be get body don't begin reduce drastically. It always tire, you know. Then if they drink too much, if they piss too much. Then they eat classic. Over weeks you they know that they. But for the type 2, it go take before you know. Sometimes some thing will happen to you. Maybe you don't cut yourself, the sun not they well, or you don't become blind, or man they don't become they don't get what's it they call it? They don't get erectile dysfunction or sexual dysfunction, then you go know say something wrong. But for type 1, you dey catch am quick. For type 2, 10 years down the line, you know say you get and pass where something massive go happen to you, like they say, sexual dysfunction, blindness. Sometimes you even get problems with your kidneys. The way you go hospital and say, well, we think say you don't get diabetes for quite some time, it don't cause damage to your eyes, you not get sexual desire anymore, you don't be impotent, or you don't get wound, the wound not well to the extent that they get for cut your foot. So now that's the happen. Then for the gestational diabetes now, the woman then when they reach 24 weeks of gestation, then for go hospital for let them test them. Just a urine test go show if you get lots of glucose now your urine. Or then do your fingertip test at 24 weeks of gestation for a pregnant woman and go know say you don't get diabetes. So now the 3 common one and then the way we they talk about way you can to mama salon.
So like any kind of age brackets the way somebody go can contact either of the 3?
Type 1 definitely not for picking them. From age 0, 1 year old, 1 day old, 1 day your mama just born you as a baby, then he diagnose you with diabetes type 1. Type 2, you can old 40, 50, 60, 70, 80, then go see diagnose you for type 2 diabetes. Then that in between now, either the late onset of type 1 or an early onset of type 2, they say would they catch them in between. Then also picking again and also adult again. So then 70 now that middle age.
So among them 3 there, so which one are the most dangerous one?
All dangerous. Diabetes, you're not going to say this person comping, this person comping. They're all dangerous. Not just the way you go handle the way it can to you.
But according to the specialist physician at Connaught Hospital, Dr. Mohammed Smith, he mentioned that type 2 now one responsible for the plenty die where woman and man they die in hospital according to a study we then do.
Not only waiting Dr. Smith saying that true. Even the International Diabetes Federation don't talk say it's a 3.4 million deaths in 2024. 1 in every 9 deaths was because of diabetes. So diabetes now one of the diseases whether they call non-communicable disease or killer diseases or silent killers. So if they cancel you silently, you know they know until it causes damage. So they're NCDs, they're non-communicable diseases, so they're very bad. And now most people they die of. Most people now they die of, but the education not the awareness not the. Okay. So now that's the thing.
Continue for the with me now the program. In name is Salome Hayes.
Heights.
And in are the founder Friends of Diabetes Salon. We don't they talk about the diabetes sick, the different type, and the signs and symptoms them. When I come back to you, we can look at what you need for be done for say the government and other partners them able for come together for raise awareness about the diabetes sick and waiting the need for do for tap the spread of the diabetes sick na salon. Continue for the waiting in the program. Inside the program, we will look at another issue. Inside some people where they use public toilet, them na the central partner Freetown don't call on the Freetown City Council for make sure say they maintain this them facility them Then people are talk this together democracy is one interview where they talk about some of the challenge them way that they face for access public toilet now the central business district. We reporters on the Abel gets more and gonna report.
One way for the country go clean and attract stranger now where public toilets then are plenty side them like the city and public place them like markets. Who side people go able make use of them where the need arise. But this facility now one way Salondo lack, particularly in the capital city Freetown, where all lead to increased poor sanitation and sick them like diarrhea, typhoid and cholera. Now for sake of this make, I've been go work on some side in Freetown and talk to people on what they think, but they need for make public toilets them available at the city.
If they didn't know the community, they avoid like waste because of toilet not heat. Like if stranger they pass, they don't fee for toilets. A public toilet they able go they use the toilet. So like if we love this opportunity, now any community, this they make people that they sick.
When I done a good initiative for get a public toilet any side there because of where they work on the street. Some can press because that's not nature. Yeah, some can one way, some can use public toilet no day. As part they go far or they go mistakenly, not to mistake the toilet by itself. So then some can find for that public toilet in any side.
Accessibility with Markins accessibility indicator for the need of everybody, including elderly people, the young people and the middle age. Then also it get economic benefit. They boost local business system in the community. They encourage people for spend more time in the area, the community, because if they get more toilet facilities, they encourage more people for day around and feel safe in terms of doing their business.
Then people are saying we so call on governments and non-government organization them for make sure say them build on more public toilets them at the city.
Because the authorities now for them engage their community then like their water like the capital city now with us some they get the compound we get compound at more get toilet but outside compound now that is toilet not get for them. So they appeal to the authorities they then go out to their community their water low their office they made them emphasize made them get them public toilet there at their place.
Well, at the call on government, also stakeholders made them come together at least. Also stakeholders on different communities and can come together also and kind of try for improve on these toilet facilities in the communities. Not only government, you get other NGOs and other stuff with ability they can cable kind side and help government for facilitate this facility.
They are the call to attention. May they help me to make get public toilet at different areas and the mainland side and so side the public transport today because somebody they want to compound to go there. But the public toilet there is no fine. So we call the authority to make the help me to get.
For fair not waiting they happen with the few public toilets them way available na the city, I be go worker na the one way they by County 3 na the central part of Freetown and now this have been able to gather.
Yeah, chairman say but the mommy who in charge will council sabi in there. Yeah, left me no more. So I'm happy who does me. Now who needs to take care of the toilet? I can collect now. I can give him money. Go left and cancel.
So get the idea of the percentage we cancel the request for.
I don't get the idea. The mammy was never send me and they say I swear to go get a cancel. I don't price no more food for me. I know more only me sabi.
Okay, so like almost percentage they get for.
It's no more now. For me, it's a self-smart for like Posika, for right sign, no easy. Mommy,
if that are in season,
not in season, yes, in season.
But dry season, okay.
Yeah, got season better small. But the mommy, you need pay me for say 2 months done, you pay me. Not soon. I need to get that facility today. The only thing no more when tell me see that patient to go make join the system na cancel. That's not the coverage and give me make a this but really me I suffer.
Okay, so now can I tell the people that really can, the customer really can use this facility? Who are some challenge them where they get from them?
So the people who can come. Some day now, it's symbol the wet side because we don't build the toilets and we make side for wet. So what we don't keep selling so we use behind that.
And for the man then?
Man now, woman who some day can give a comment say, so we give them find side for wet. And what make now? Personally, was don't say the toilets possible go wet stay. If someone can now, you can sit down for a wet stay and sick. Then from there back, that wet stay, go wet stay back to water facility. So get for flush stay. So the water, you go boku. Never could decide for using where you use behind that. But then comments for that, in people and they will kick down for camera.
What I understand is that this one not to flush, did it?
Yes.
Now flush. I understand say flush they use them for pee, they use them also for toilet. So I would not mean one and say person they will use them for pee. If well, they're in good condition, I think say person they will use them for pee. If not they keep
no see really cause they make now where they go behind that because the woman they really kick out, they kiss it around it. Then they kill the parents sign, then pardon the you don't come inside you it's careful for sale for let go. The way go man for the whole block. I like it on the one door myself, so you not going to go. And make can decide say the way to the west behind that.
Well, tell people they actually come and not educate them or stop them.
Yeah, you tell them some possible you know say you don't go now. At times passing and upload the scene and change the pipe back.
But I never take them concern and so to cancel.
Well, the mammy they get contact to cancel. Now again, who contact to cancel?
You don't tell them the challenge.
I don't tell them. I don't tell them.
So what's not being response to the challenge?
Well, me I don't see no response. I never see no response. Even the place they leak, this need for repair. What's someone on inside? The seaside.
Because the seaside for male side for female, but the female side he look like totally.
Yes, like totally now don't block. I make them lock this way.
Because your side don't block. You need flush again. For also not if waiting channels say they in line with people where they use these public toilets. I've been talked to some pardon people, yeah.
FCC then build this toilet for the people and for the public and then try that side because when they see people in the street because of courts them they use but not all my Sabina courts and not all my they allow that for the Gona courts. So when they can build this now and they do well and they help the people then when they come around here and the offices around here. Well the only challenge is the way like the toilets can get number one like when the toilets can don't full up you know can be lamp to time then the toilets no get light people need to use our place dark past the hours and if finally people they for the user wait for the day say the other morning because if they get light people then they use them but now even say no more you don't lock.
Well actually the expense what I get for the toilet the price no matter but normally sometimes so we for go yard we can smell some wet smell from the toilets hold on keep come on do from the even some you know so that drug infection who go the toilet do not be flush are fine I know if in our town I know they always see so sometimes the toilets they pass through the people that okay enter for toilet pass through say call that bucket of tap flush they I think it bring infection for we people that already smell it.
China say and some pandemic people here where they use these public toilets and for call on Freetown City Council for make sure say council come to the aid for the monitor and maintenance these public toilets and all other one them within the city for improve well body and proper sanitation. For the Society for Radio Democracy, Mina Sonia Bell, the report.
And the program now midday show they come to you live from the Society for Radio Democracy 98.1 FM. I come over to me studio guest with Madam Salome Heights. We are the founder friends of Diabetes Salon. We don't talk about the different types of diabetes. Again, one go the ask diabetes sick now one with the men.
That's a very tough question. Because you see some people that go tell you say then don't reverse the sickness, then don't follow the doctor's instructions, then don't be very strict with themselves, and they don't reverse them. They don't pull them per medication, because when you get diabetes, the one thing where you get for do for yourself, now for let you be strict with yourself. You get for really show yourself tough love. If you not show yourself that tough love, they not they fine for you. So because of the amount of people where they suffer from diabetes, right now we get 589 million adults. These are between 20 and 79 years of age where they live with diabetes worldwide. Even that number, I go say, still some people they not count, because countries then like we not get a register yet for diabetes. So we know they not just the projection we International Diabetes Federation they give. Now we they follow. So I'm not gonna say that sick where you they able for men, because if you look at the people that we don't reverse and the people that we they still suffer from them, we're not gonna say nothing where they men. But if you manage them well, it will fine for you. You follow your doctor's instruction. If they say healthy eating, healthy living, you they eat everything in moderation, you they exercise, you follow your management plan where you healthcare professionals they don't tell you that you can live with them comfortably. But if you left waiting and tell you for do, then you get for ready for the complications that we go cancel you, the heart disease, the kidney failure, the gangrene toes, the amputation, the impotence, the sexual dysfunction in both men and women. Not to man, they no more go get sexual dysfunction. Even women, and they get nerve damage from diabetes, we go make them lose all desire for do mama and daddy business.
One area where people don't say that diabetes sick, now mostly they target people who get money. Not true?
Well, then they not been tried. They say diabetes na the sickness of the affluence, but then they not so it be now. Everybody they get diabetes now because of urbanization. First time, now the people that were gently, now they eat good things. Then where we feel say na good things, and then they eat baked beans, and then they eat mayonnaise, ketchup. Then they always get lots of sugar, lots of salt for let them preserve them. Now the people that we been get money first, now they eat that. But now if you go na village self, somebody get somebody abroad where they send for, they go send baked beans, they go send lunch or meat, they go send not lunch or meat, baked beans, ketchup. Would they go na place there where they sell food? Do they eat lots of chips, the French fries or the potato chips where they don't fry na oil? So that oil they always they put on your body just because of urbanization. And urbanization not so just for food where we they eat, even with lifestyle. Everybody get TV now in house now. Everybody get car. So that work away with people there, we ancestors they be they work out from time immemorial. We know they work at that work at again. Somebody they come on, you build they go St. John, pass away for Okada or Keke. It can't work. So that now the thing we don't make the sickness, not so just gentleman they catch now. Even we not get money, is they still catch we because of we lifestyle don't change. Everybody they live now like somebody we live abroad or we live in the city.
Okay. One concern we don't they come out from people where they live with the sick. Now the availability of the insulin, where now one of the treatment methods and where they're supposed to take, where most people can say either not available or expensive. Now, from your side as Friends of Diabetes Salon, in terms of the facilities, including the insulin, the day in the country?
Insulin day, not get me wrong, insulin day, we even get hospitals them where then at the provinces where if you register with them, especially if you're not a type 1 diabetic child, where without insulin you they die. If you go register with them, then go always make sure say you get insulin. Insulin expensive, but more so now the type 1 that we they worry for the insulin, because the type 2 them, the adults them, unless when you don't make trangayase, you not take your medicine as you supposed to take your tablet, then go say okay, will they add insulin for you? But the one that we really need the insulin are the type 1 picking up, because then one and they without the insulin then they die. Because if the diabetes don't go so high, we call her hyperglycemic. If they don't go to that hyperglycemic state, they're not get insulin for choke themselves with, for let that blood sugar they go down. The body they begin feed on the fats where they get. Now that made the pikin and can lose weight. So when the body begin feed on the fats where they now the pikin in body, the produce of that fatty acid they call it ketones. If the pikin don't get them ketones now in body to a high level, it don't sound like the blood get acid. It sound like in blood don't get acid. And that acid like blood where they go now all the organs then now they cause trouble. The pikin go die very quickly. So insulin are a challenge. Not only insulin are the challenge, even for the one that we know they take insulin, the one that we know the type 2 them. Even the medication, and also only the medication, even the food choices. Because you're not going to be a diabetic, all you eat na rice, or all you eat na bulgur. You get for have a balanced diet. You get for eat a proportion of your fruits and vegetables, you 5 a day, fruits and vegetables 5 portions a day. You get for eat less carbohydrates, you eat more greens, you eat lots of protein. If you know they do all that are challenges na mama salon, not so just the insulin. Yeah, the insulin for the type 1 picking them. So, but for the adults there again, what about the food choices? Fruits and vegetables, how many people they afford that? So diabetes not so an easy call if you get them.
So let me look at what your organization, Friends of Diabetes Salon, don't they do for in terms of raising awareness about the effects of the diabetes sick and waiting people in need for do. Either they not get the sick or the one that we don't get the sick. What's the need for do for CC then maintain the treatment and all that in there?
Well, what we they do, they raise awareness in hard to reach areas. Side away people that they remember say them for go with they go raise awareness. Why? Because they say prevention is better than cure. Would they tell people that say this sick care day, would they give them examples with the quote instances for them where people then sabi somebody they then sabi we don't get long standing sore now in foot we not where then get for go amputate. Everybody knows somebody we get sore where then say na which make you get that sore. They don't know say na diabetes you get people that don't get blindness because of diabetes. The glucose don't sit down at the lens of the eye, it don't block them, pass and go do operation. So everybody knows somebody will get diabetes where bad thing don't happen. So somebody go say me possibly they then say you get kidney failure but will not get money for do dialysis, the person don't die. So everybody get that. So we they raise this awareness here more for let people that not get this sick here. Like what I say, just no prevention is better than cure. Where you prevent yourself from this sick here, it's better for you. Would they do them public outreach here? So would they go to them communities here? So would they do tests and advise people them? Say right now your blood sugar is high, but if you stop for eat the white sugar, you stop for eat boku white rice, you stop for ride keke, just walk and let you sweat. You know, exercise, burn the calories where they eat. People that then arrest someone and they eat, they're not going to eat 1 carrot, they're not going to eat half a slice of cabbage or runner beans or tomato or cucumber, they're not going to eat nothing and rest no more. So now that means we they go to communities and for raise the awareness, because one thing where they make people that they get diabetes today on a very large scale now with diet. And if you look at the risk, what they put you at risk of diabetes, just being a black person don't put you at risk of diabetes. Because we food mainly na starchy foods we they eat as black people. So we carbohydrates.
We see also that they provide free screening for people either where they go at the centers they will not day or the conference we will not just all. This free screening, what's in it about?
Well, free screening like what we say early detection save lives. We they screen people then for both diabetes and hypertension because people then they back like I said they not afford for go do just then fingertip test for say if their blood sugar high or do them blood pressure for see what the reading will be. So when we go do then test here so now the communities, we must catch 1 or 2, 3 people where their blood sugar is so high they don't even know say na so high or their blood pressure. Then we advise them. We advise them, we go work for them for weeks. We they work with them for weeks. every week we go test them. As long as they follow with instructions, we don't give them say cut down on this, cut down on this, cut down on this. Some people they adhere to that. If they do that, then say go see say I not eat wetin then people here tell me make I not eat. And now look, my blood sugar don't go down. And I don't cut off salt na my diet. Look now, my blood pressure not high like high. With that, you they prevent them people here so for me they not get the sick. Because once you don't get the sick, for let it left you, not so it know they left you hurry like we get you. So that mean we they do that, we cancel people them. We don't do it with so many people. We they catch you, you get high glucose levels. We tell you waiting you for do. If you follow the instruction,
in a situation where una do a test on somebody, where perhaps in glucose level they high, which one I can do at that point in time?
At that point in time, we dey work with the person because me a health coach. I dey work with you for 2-3 weeks and see if you go follow me instruction. I go tell you what you forget for breakfast, what you go eat for dinner, and what you go eat again later if you not possibly go afford that. If not so that day, all we they do to you is advise you on how you for eat and how you for exercise. If you get big body, we advise you on how you for lose weight. And some people they like I say, then follow that instruction, then the number can down. They not put them on medication. But if we don't work with you now, we don't say it's chronic before we get to you, then we go advise you go see a medical doctor. We go work with you from there and help you for make you able to manage the condition. But we not they just catch you and say, okay, yeah, the medicine or go to this doctor. We get for work with you first because now that's what we want for do. Because early prevention go save you life. It go don't show you get lots of information on the disease where you get or the condition, diabetes, if you listen to what it and say. Everything in moderation. Everything you do in moderation. If you drink beer, you drink this soft drink, when I just coloring, sugar, and carbonized water, drink it in moderation. Not drink 4-5 soft drink a day. Not just sugar they put in your body, we're not fine.
You don't talk about waiting on organization on the door in terms of raising awareness and also providing free screening for people for checking status in terms of their glucose, sugar, and their body. Again, we earlier talked about the challenges where people are face, we get the sick. On the side of government, you work with the Ministry of Health. On the side of government, what do you think, say, from Unayon point, government, in particular the Ministry of Health, for say, we go able for either minimize or tap the spread of the sick?
Well, what thing we they do and the ministry they do right now for put taxation on them drinks that we get sugar, put taxation on tobacco, because if you get diabetes, you get hypertension, you they smoke. Then they not double jeopardy for you. If you get any non-communicable disease, you they smoke, you they eat lots of you they drink lots of sugar, drinks them. So the Ministry of Health, they try for do that and then they try for actually put taxation on then drinks there where they know say dangerous for the population, not just the diabetes people then. Because the diabetic person don't already get the diabetes, but what about the young ones the way they come up? If you try for put taxation on them thing and then now, then you they try for stop them for let them not eat that kind of thing. And then they try again for do lots of awareness. The ministry they hold radio talks with their partners and like Quam with the whole radio talks. Quam said they do lots of screening at the communities. All this and for me tackle this, and we they try again. The government go put in policies. How we go able for manage the people that will get diabetes, how we go advocate for them when it comes to medication or even food. So then say they do very well, but you know say the number every year they increase, and government not go to individual people for help for combat this disease. Together we go work with the government for let we make it easy for people there.
So I believe say if there is a kind of taxation on beverages and when they come to the country, that's able for minimize the spread of the diabetes sick?
Yes, put taxation on beverages, on anything way dangerous for people.
But we also they make drinks in the country.
Well, they're safe. Now they're more the one the way they made the drinks and because charity starts at home. Now that we get for CC, then put the right ingredients in the food and the drinks. But wait till they try for say Then people they make the drinks then. They not force you at gunpoint for go buy. If you know say the soft drink not good for you, don't say it's just carbonized water, coloring and sugar. You know say not good for you. Nobody not puts gun at you hate to say you they go buy and powder. You stop for drink then in a day. You best drink na water. Drink water, hydrate yourself, take the toxins out of your body. You know, now your health now on you day. Government can put all the taxation where it wants for anything, but the individual and get for make a choice.
I think say that possible.
Well, it happen now other countries there. If we work together with the government,
But
it
for
go
salary,
possible.
it
It go possible, yeah. It just let the population think say waiting they do now for their young good.
One, they say, why not raising more awareness on the disease, the danger of the disease, instead of advocating or also engaging the producers of the drinks here. So instead of advocating for high taxation rates on the drinks here.
All them thing and they go hand in hand. To be honest with you, they raise awareness for let the people that listen to you and take appropriate action. They do public screening, free screening for people them for let them know them figure and take appropriate action and make informed choices. But it left to the individual. Government go put all the things in place, but the individual are not responsible for your own health. Not a government go say no eat this, not eat that. You get for no say you get for do something if you want for live long.
Salon get any kind of data where they show the number of people where they suffer from the diabetes sick?
They work on that right now. They work on that. Me conference, we don't even get an app where anybody can tap into now. When we launch them for make it able for put in results where we they do in collaboration with the Ministry of Health and Sanitation and the Directorate of Non-Communicable Disease, where they try for get a data stored now where we go try for get with your number of diabetics in the country. Like where we start this thing, I tell you say now that we not get. All we get is projection from IDF, that's the International Diabetes Federation. It go tell we say in 2050 so people in a salon go get diabetes. But it just they give you that figure they maybe it compare with countries that we get data, it look at we size, it look at that country's size, they say okay, we they give salon this figure. But we want let we come up with that projection. We want for do we own where we go begin collect the data.
So the app we not don't develop. Now how this app they operate?
Well, it get for where we do any session where we do now the communities. We number not so we number we get all the other NGOs or other health organizations and get where any side them go do any screening or anything where they do as outreach. The data go do the inputs. They go tell you whether they be diabetic. It go tell you whether they be hypertensive. It go tell you the ratio of everything. You know, so we just start, Friends of Diabetes, we just start with we own. When everything comes to work in order, the ministry self gets in own, then we they give the ministry the data where they need. So we self, in not long future time, we go able for say, yes, hello, this now we data we don't collect, we go extend out to the provinces everywhere. Because not to Freetown number, because Freetown is not Sierra Leone. Freetown is Freetown and Sierra Leone has so many other towns, so many chiefdoms, so many towns, so many villages. So we get for
this thing get for do with any kind of internet business?
Not really. Not really.
Okay. So
because everybody waiting now they say it go get internet business, but I don't think say it go be that great challenges because if you look at the population as salon, everybody gets. Even the people in a village then get phones that we get.
But there are places them where hard to reach areas them where they facing or get internet challenge.
Yeah, but really, if you look at, there's always a focal place where that go be. If we get 10 villages around there must be one town where maybe gets a PHU where they go feed into. I think say that they happen. And you look at the population of Sierra Leone self. I go tell you say maybe 80% of people now get Android phones or iPhones where they're always there online, then they're on WhatsApp, then they're TikTok, then they're on Facebook. So I don't think say that they will be a very great problem because everybody internet was or IT wise up now.
You mentioned earlier, say, as of now, Salono get a comprehensive data where they show the number of people where they suffer from the sick. You see that as a slap on the side of government?
It is not, because not a Salono no more. We get, okay, if you look at the whole world, and you look at the people that way they actually embrace diabetes awareness and the global awareness raising, it's just like less than 200 countries they do them. So if we don't begin do that in a salon, now a start point, everything gets to side they start. We get how many countries in the world, but less than 200 they do global awareness raising on the 14th of December every year since then start. You see, so at least we don't start, and we they progress, and we they feel say with all the partners then where they tap into the diabetes care, we think say together we gonna make a difference.
So the conference we wanna get now, the second edition of this conference we wanna get. Now one we wanna get for the keep on the organize for bring people and come together and talk about the diabetes sick
every year by the grace of God.
What's not the essence of this conference?
Just global, a whole country awareness, because we go on radio, they're on TV, and on Facebook, and people that already know what's in front of diabetes they do. So the essence of this is get all those sabi doctors them for can't talk to people there about diabetes, because people then they will get diabetes, they don't even know what type they get, they don't know what are the complications, they don't know what they put them at risk of this. Someday they don't even know about management, and then to cover it all, we they try for talk about prevention, because if you don't do a conference like that, you don't catch people them. The one that will not get, then go see that they will plenty. You advise them on waiting for they not get the sickness, because that prevention, more prevention, and talk about type 1, where people they don't know about at all. Let people that are aware. Say type 1 day and at this for look for. We even they plan for do sessions that schools them for teach the teachers them about the type 1 symptoms. So when a child they show symptoms of that 4 T's now you class, you go know say this speaking something like diabetes contact the caregiver, which is the parent, make you call it and go do in fingertip test. So
as we round up the program, what think will be your message not only to people either where they suffer from the sick or people will not get the sick yet, and including government for say work as one for address some of the challenges them or tap the diabetes sick for letting us spread further now the country?
Well, what I go say to government is to include diabetes awareness in schools them. Like we get health education, during that health education period, let them talk about not only diabetes but all the non-communicable disease them. Let them picking them aware from that early age. Let them know say too much salt, too much carbohydrate, too much fats and oils not good for we. Because if you teach the picking and that, then they go home in turn and teach them parents them. Then at one, the government will help do that day for include that in the health education. Then we do lots of public awareness on radio, TV, in how to reach areas, the suburbs, the provinces, everywhere. Some radio station and then they go far and wide. If we hold awareness now radios where they go far and wide, where they reach out to communities, I think they have that awareness raising is very, very important. Then the government can help we with vehicles where go out with megaphones, just the public awareness, and the schools then forget as part of the curriculum. I think that they go a very long way. Then we they able for do stuff, because diabetes is huge. We get lots of organizations where they do stuff for diabetes, and together we go make a difference. Every day they talk one thing. You go able for reach out to people that way go listen, because then they see no household no they will not go get the story say me possibly die they be say that diabetes, or right now get possibly we get diabetes. Every household will get a taste of this, so that for them we all come together and work for the benefit of we own health. because government go do wetin they do, but individually we self responsible for we own health by taking care of we self, by eating healthy, living healthy, and doing stuff for make we take care of we self. Especially the man then they know they go hospital, then they wait for them force them for go hospital. The woman themselves now then they take care of the house. Let themselves get time for take care of themselves and their family. So together we all as a nation we go work towards this non-communicable disease, not only the diabetes, even mental health, even the cancers, the lung problems, the kidney failures. We all can work together for make a difference in our country.
One for say plenty thank you to you, Salome Hates. We are the founder, Friends of Diabetes Salon, for we take it time for be part of the program today. Well, now we go bring down the curtain for today's edition of the program Midday Show. Plenty thank you to my producers, Abtiu Kalon, to DJ Schoolface for technical support, and also Fatmata Samura. We make on see we live now on our Facebook page. So till we meet again, me and Adeyemi Jackson, they say goodbye.